in the last 10 years, since RISCESDAS, that's National Research on Health, that was conducted in 2007-2013, it shows there is a huge problem now in Indonesia, particularly in non-communicable diseases such as cardiovascular diseases, heart disease, and stroke, diabetes, and mellitus. And also from the data, BPJS, that is National Health Insurance, shows that the majority of the money actually goes to non-communicable diseases. So it seems that the NCDs took over the communicable diseases in the last 10 years.
So we've actually called this project Measuring What Matters, because what's not measured or reported on can't be actioned.
We tried to mapping out how Indonesia now monitoring NCDs, and we're looking at the global picture and look at the Indonesian policy, and we do some overlay, and we will see what are missing there.
So specific examples: diabetes, really important non-communicable disease and a focus of policy in Indonesia. But what we actually found was that it is emerging earlier in the life course than what is currently expected. Measuring it accurately is key to being able to make the right decisions and address the issues that are arising. What's required is actually a shift in how we measure the health of the population, because the focus has been on communicable diseases for so long and tackling them. There needs to be a change in the types of things that we measure and how they're measured across the whole archipelago, so that we can get a better picture of the health of the population. One of the things that we recommend is that reporting of NCDs across Indonesia extend beyond the 4 main NCDs that are covered now. There is a greater focus on musculoskeletal conditions, mental disorder, and neurological conditions, and things that are impacting on across the whole life course, not just in adulthood. From childhood to adolescence, there's a really rapid transition and change in the burden of disease, and that presents a really important point of intervention. So one of the things that we know about non-communicable diseases is there are a range of shared and modifiable risk factors that contribute to the development of those diseases. So the more we know about how those risk factors are interacting across Indonesia, then we can make better targeted interventions for prevention.
The community participations and government, commitment on NCD are really important, because most of the NCDs risk factors are socially, constructed, and that really need community, involvement. And then also, for instance, how do the government actually encourage young people to be physically active? How do government actually, invest on to overcome a poor diet in terms of lack of eating on vegetables and fruits, and in particular for reducing the smoking consumption in a young age. Indonesia now huge problem with smoking, and that's really required government actions at the national level. And of course, we'll do at individual level, do the health educations, but also we need a government to create environment, develop a policy to address these particular problems.